1, 2, 3, 4, 1.
Greetings and welcome to this episode of the Kokayi Academy for the Healing Arts. I'm your host, Dr. Kamau Kokayi, and today I want to focus on why you may not be getting the kind of care that you actually need from your mainstream doctor relative to what's supposed to be a strength in Western medicine in terms of a biochemical understanding of what's happening in the body. Now, for those of you who've tuned in to previous episodes, you know that I always look at all healing arts and traditions as being an outflow from culture, basically being cultural technologies. And in looking at various cultures of the world, various systems of the world, I realized that healing or the interface between practitioner and client or patient takes place on one of four levels. Biomechanical, whether that's from massage, structural manipulation, surgery. Biochemical, whether we're talking about nutrition, we're talking about nutrients, botanicals or drugs. Bioenergetic, whether we're talking about acupuncture, whether we're talking about aspects of kinesiology. And then spirit consciousness, whether we're talking about talk therapy, homeopathy, trance work, quantum healing techniques, and so on. So within that framework, of course, allopathic medicine or mainstream Western medicine really focuses mainly on biochemical and to some degree biomechanical realities. But what I want to point out is that the biochemical realities that it focuses on are really limited, and is limited by the cultural imperative. The Western cultural imperative is for the individual to grow, to expand, the reasoning mind, which is now translated into a corporate imperative for growth, using science, technology, and I would say any means necessary to achieve its ends in terms of growth and dominance of its particular arena of functioning. Within that dominance, of course, other entities or realities are either ignored, discredited, or co-opted. So what's happened is that the emphasis on Western medicine in terms of achieving its ends in terms of growth have focused on new drugs, right? New techniques and devices, right? Procedures. But none of these things necessarily mean that you're getting more health. These are things that are important for that growth, but may not necessarily be important for you. A new proton pump inhibitor for this next generation, to block your stomach acid, is that really actually healing or creating a kind of effect that's going to benefit you? The answer is generally not. And moreover, you have a whole health food industry where billions of dollars are now going outside of the Western medical framework, because people are realizing that there are profound limitations in terms of these drugs, in terms of these procedures. So this has become an issue. Now, it's really too bad, because doctors in the first 2 years of medicine, you're trained to appreciate the body in terms of its building blocks. You're trained to understand about vitamins and minerals acting as coenzymes and cofactors. But you never really graduate into orthomolecular medicine, where you're actually using these things to treat people. You go from there, go to the drug house, where you're learning about how to use pharmaceuticals. And while many doctors realize, hey, you've been in practice 20, 30 years, you get a sense that, these drugs they're creating problems. These drugs look like those drugs you see being advertised on TV, where the smiling actor is saying, yeah, it might help you to sleep, but it can cause your kidneys to fail, it can cause any number of other problems. And the question is that the kind of health care that you want? Meaning, because the Western cultural emphasis on the profit making and the need to do that, then what they've done is they've taken over the education of doctors. So doctors are learning things in these particular areas and they're not learning these other areas. And that's kind of an old story now, because there are nutritionists out there, there are people that have facility in terms of using the nutrients that are in the health food stores, and people have that information. So the biochemical framework has actually been narrowed down, but even more so to our detriment because of the profit motive in genetically engineered foods. The profit motive there has created a real problem, and because doctors are educated within a framework where you don't want to create problems for certain industries. You know, we have a reality where doctors aren't really aware of the kind of gut pathology that's being set up by the introduction of genetically engineered foods around 1996. There are about 8 or 9 different foods that have had, you know, 2 major things done. One, they're by inserting a gene from a bacteria that will make that food more resistant to a particular pesticide, Roundup, for instance. You know, more of that pesticide can be given without killing off that particular crop, which means that we get more of that pesticide, and Roundup actually happens to kill off some of the normal bacteria in the body, right? And then there's another one, the Bt toxin, which is, you know, created by certain bacteria, and it causes the stomach of insects that would eat certain plants just to blow out. So that it actually has a protective effect on the plant, you know, against certain insects. But guess what? That particular toxin also affects human cells, and by punching out holes in human cells, it creates something called leaky gut. Well, leaky gut means that when you're eating food and now it's not being properly broken down, right, that food will actually get into your system and create all kind of immune effects. So many of the problems that I see in terms of the increasing incidence of autoimmune problems with the thyroid, Hashimoto's disease, Graves' disease, rheumatoid arthritis, sarcoidosis, not to mention gut inflammatory problems, irritable bowel syndrome, Crohn's disease, ulcerative colitis, actually have to do with some of the effects of this, these genetically engineered foods. And while wheat itself may not be genetically engineered, what happens is, you know, all of a sudden we're hearing about gluten sensitivity. And there's some doctors that have actually warned people, well, if you don't have the extreme form of this, meaning celiac disease, where, you know, a few parts per million of wheat can actually cause all kind of horrendous problems, including death, then you're really doing yourself a disservice by not eating the wheat, right? Because of the vitamins and minerals you're missing. You know, this is a staple. But at the same time, clinically, we see so many people improve when they remove things like wheat from their diet, genetically engineered soy and corn. In part because, you know, genetically engineered foods don't have the same nutritional value, right? And if you're having this leaky gut syndrome, your body really requires more glutamine, right? Glutamine is an amino acid that will help heal the gut. If you have genetically engineered soy, when you heat that up, it has an inhibiting factor on trypsin, which helps to break down proteins. So you're not properly breaking down your proteins in your gut, which creates more problems in terms of your digestion and gut ecology. It's a mess. But doctors aren't really dealing with this. And I've actually heard gastroenterologists say that our food really doesn't have anything to do with the kind of problems that people are getting there in their gut, because they haven't been taught in a way that allows them to include this data and this information. let alone actually then act on that and begin to help people make certain changes and to take certain foods. So because of the cultural imperative and focus in terms of allopathic medicine, the things that hospitals and institutions have to do in terms of focusing on procedures and things that actually make them money, and research with pharmaceuticals that actually bring money into the hospital, you, the public, may not get what you need. And that's just on a biochemical level. And as I mentioned, there are 3 other levels that really have to be taken into account when we're thinking about what's happening with human beings. Now, the Western cultural imperative in terms of the kind of material focus, right? Oftentimes that's placed in contradistinction to the East. So there's Eastern and Western medicine. And one of the key concepts in the East is balance. Whether we're talking about yin and yang, parasympathetic, sympathetic, balance is really lacking when we start talking about allopathic medicine. I don't have a problem with an antibiotic to be used properly or surgery, and clearly I've seen those things when they're needed. I've taken an antibiotic, I've had surgery, but it's balance, it's looking at the whole thing. Why would you give an antibiotic without also having somebody take a probiotic, right? Or if we're going to do surgery, how does surgery actually affect the energetic anatomy of a person? What would be a proper way to actually approach that, right? The same lack of balance we see with the use of fossil fuels, the effect that it has on the environment. And just what I laid out, with certain pesticides, fine, you're trying to protect certain crops, but you're creating a host of other effects. Because the wisdom and insight, Western medicine is an offspring of a very young culture in terms of Western culture. And a lot can be learned from looking at what traditions in the East, in Africa, and from around the world have to say about that address the concept of balance. People didn't develop in such a material fashion, but for many reasons out of choice in terms of living in harmony with the environment. But we'll talk more about that in other segments. But I just wanted to share with you about this biochemical piece and how important that is in terms of laying a foundation for our health and looking at other areas. So thank you for joining me, and remember that we are spiritual beings having a human experience. Blessings.